Hello there. Are you a SEN parent and are you guilty of doing everything for your SEN child? Or do you know a SEN parent or a caregiver who tends to do everything for their SEN child even though that child is able to do it for themselves? Have you come across the word infantilizing? Well, keep watching because I'll be discussing this. So generally across the board, our SEN children need help. In order for them to function, they need support, they need help. It's essential that there is support in place. There's extra support for them to be able to function. Again, there's a caveat here when I talk about infantilizing. I'll define it in a minute. But it's also important that we understand that no autistic or no SEN children are the same. For example, two autistic children might have the same diagnosis, but one child B might have some other needs, some physical needs. The two might have the same diagnosis, same physical needs, but they are still not the same. Why? Because child B might come from a single parent household. Child B might come from a poor family. Child B might come from a household where there is no support. Child B might actually come from a household where he or she has other siblings on the spectrum. So you see, that's why we can never compare two SEN children. And so that is why what I'm talking about might not be relevant at all, might not mean anything to some of you parents and SEN families, and this is absolutely all right. However, I feel I need to talk about it because I have made those mistakes and I continue to make this mistake, which is infantilizing my child. And I think some parents even do it without even realizing it. And so I'd like to talk about it. So what is infantilizing? It's treating our children and younger than their age, and it's treating our children as less capable than what they are capable of. How do we know we are doing it? First of all, is we infantilize our children who consistently do everything for them. And when I say everything, I mean everything for them. See, when our child was diagnosed maybe at the age of 4, they didn't know how to wash themselves. We had to do everything. But we realize that maybe they are now 7, 8, 9, 10 years, 11 years, and we are still dressing them. Not because they are not able to do it, but it's because we are assuming that they are not able to do it. We are assuming that, they will waste our time. It's easier if you do it. I must say again that this does not relate to all children. Some other children or some households find it very difficult. They have, other difficulties. So it doesn't apply to all some households. But I'm saying generally, we have to be aware that the moment we continue to do everything for our children and we don't give them the opportunity to expand their knowledge and also build on their basic skills and develop life skills, then we might be infantilizing. And I'm talking about it because I am guilty and I am still doing it. Again, we know we are infantilizing our children when we make decisions for them. Yeah, when a child is young, 3 years, 4 years, they're still children. Most of the decision will be made by you. However, a 14-year-old in a school, in a meeting, we must give them the opportunity to make the decision. For example, if they're in a meeting, we don't talk over them. We don't speak to teachers or professionals in their presence without asking them of their opinion. Because they have a way of communicating. Even if they have significant speech delay, we know there is a way they can communicate. There's a way they can say yes or no, I disagree. So let's not just make every decision for them, especially when they're older children, because we are assuming they cannot speak or we are assuming they are too anxious to share their views and wishes. Another reason or another way we infantilize is that when we don't offer them choices. We don't offer them choices because we dismiss that they wouldn't know what they want. You make them too upset. It's easier. Or some of us say, no, we don't offer them choices because we know our children. We know they like toast for breakfast. And so they've had toast for breakfast from the age of 2, from the age of 3 until 7 years old, 8 years old. We're still giving them the same, because we believe they'll be upset or they'll have a meltdown if we give them something different. That might be true, but we need to push, we need to stretch them. We need to, unless maybe they have obviously a dietary need or they have a health need, we should be able to offer them other choices. And they might have a meltdown, but I'm sure with time, if they know there's no other option, but they're having this, there's no toast in the house today, and they're having this breakfast, they might consider having it. Let's just be aware that in our bid to protect and care for our children, because they are really vulnerable, we don't infantilize them, we don't delay their growth, we don't withdraw the opportunity for them to be independent and build on their skills. One of the reasons we will know that we are infantilizing our children is when we become overprotective of them. Children are vulnerable. Some of them are not aware of danger. You can't just let them walk out the street. I'm aware of that. However, let's say a typical 14-year-old boy who is quite verbal, is invited to his friend's birthday party. The parents already. The parents are promised they'll be supervising the children, and yet the parent will insist, my child cannot go because I need to be there. I want to be there just in case he has a meltdown, just in case he's dysregulated and all that. He's 13, he's been in his meeting from the age of 3. He's 14, he's going to a familiar place. There'll be a familiar adult who you trust there. Do you really think our child will not cope, or are we just anxious? Are we just worried? And so as parents, be aware that we don't prevent our children from getting all these opportunities. It's important, obviously, to lay the risk and to identify the risk, but we should not remove all the risks. Otherwise, how do our children grow? How do they become resilient and more independent if we want to overprotect them? One other way we might be infantilizing our children without knowing is limiting the expectation. And I think this stems from the fact that we believe, or we totally agree with everything professionals tell us, including teachers, that your child is good at math, but he is not good at handwriting, he's not good at reading. And so we were told this from the age of 4. Our child is 14 now, and we're still allowing teachers to limit them, or we are limiting them ourselves. A typical example, when your child was at the age of 4, you normally give him an easy book, an easy visual book. He's 14 years old now, and you still want him to read the same book because you're assuming he cannot read other books. You're assuming he cannot be stretched. Let's be aware, because then we are limiting them from actually making progress. We are assuming that they are not capable, and we are treating them less or younger than their age. And so limiting expectation is one way to know we are infantilizing our children. Another way we can tell we're infantilizing our children is to using baby communication with our children. So using baby talk. And I always say, I'm saying I'm guilty. Remember, I said right at the start, I am guilty, and I am still guilty. And I'll give you an example. Just very recently, my child is 13, and he did something really great. So my child helps at home. So he will empty the bin. He does the laundry with his sisters. He has some chores that he does at home. And then he did. I can't remember what he did, but he did something really good. He helped at home. And then I just caught myself telling him, oh, clap for yourself, clap for yourself. 13-year-old, who tells a 13-year-old boy to clap for themselves? I used to tell him that when he was 4 years old. And he's 13, and I was still telling him, I just caught myself and said, gosh. But he did, he clapped for himself. But you see how sometimes you use baby language or babyish communication with our children because we are not even realizing it. And some children actually resent it. I remember there was another incident. A professional came to visit my child and myself, and my child was in the dining room and we were talking about him. He was right there and we were talking about him. He walked to the professional and said, go now, bye, go. And I could see he was upset because we were discussing him right in his presence. We did not even call him in to ask him. We just discussed him because he has significant speech in there. But he has a way of expressing it. He expressed it this time by telling the professional, okay now, bye. And so, in summary, this will not relate at all to some of you parents because of the needs of your children. But in general, I just wanted us to be aware. And the reason why I wanted us to be aware is because I am guilty, so it's guilty. Let's remember that our children can thrive with a little support. Let's support them, definitely support them. Let's ensure they are safe, definitely ensure they are safe. But let's remember that the support is not to replace their independence. As our children age, we will also age, and we will need them to be able to be independent and do things for themselves. So let's start now if you haven't. Alright, I hope this was helpful. It was helpful to you. You definitely share. If you know a family who needs to hear this, please share. Alright, so thank you for watching. Look out for the next video. I'll talk about the benefits of not infantilizing our children, and I'll also discuss some of the reasons why some of us parents infantilize our children. What is the root cause of overprotecting our children and doing everything for them? Bye.